My name is Dr. Sunil Sharma. I'm a bariatric surgeon and director for New Life Surgical Associate. This is my part 2 of the video teaching the suturing skills. In the first part, I explained the basic information about the needles, about the sutures, the instruments, how to hold these instruments, and the movement you should have. In this video, I'll tell you different type of suturing, the basic principle, and will demonstrate a few of the commonly used suturing techniques. So depending on how you suture, the suture can be either continuous or interrupted. Interrupted means you take one bite on each side of the incision and close it. So you space this interrupted suture so that there is a gap in between, and if you're expecting some fluid underneath, the collection should come out, so you can use the interrupted sutures. Or sometimes you're worried about infection, I would prefer putting in interrupted sutures. And if you start the suturing at one side of the incision and run it continuously without tying the knot, that's called continuous suturing. So continuous suturing provides a watertight barrier, and so less chance of infection. It's faster and widely applicable in certain clinical situations. Now, depending on how you are placing or where you're placing the stitch, if you are piercing the skin at one side and coming out the skin at the other side, it's called simple suture. The disadvantage of that is there are two needle marks on the skin and a transverse hedge bar from the suture to the skin. So the results may not be the most optimum in terms of cosmetic or aesthetics, but it can be very hemostatic. Let's say you have injury to scalp, which is very vascular, bleeding, you can put those interrupted simple sutures. Now, if you do the suturing in a way that it does not pierce the skin, it runs underneath the skin, and the knot is buried, then it is called buried suturing or subcuticular stitching if you are closing the skin. Now, subcuticular stitch, you can do it in interrupted fashion, or you can run in a continuous fashion. So these are the basic simple types of suturing. If in a difficult situation you are not able to get the edges together, you can always use a staple to approximate the skin. Again, the basic principle of good suturing is, one, the two edges has to be aligned perfectly in order to produce a hairline scar. Number two, you should not strangulate the tissue. It should be approximated with just enough strength so they're approximated. Not too tight, not too loose. Before you start suturing, make sure your skin is prepared. Use a gauze, clean the area, and make sure the skin is clean and the wound is clean so that you can see exactly where the dermis is, where the skin is. You can identify the junction. The basic principles, get yourself in a good position, make sure there is adequate lighting, they all help. So these are the basic principles. Now I will demonstrate different type of suturing to you. Thank you. So that's the demonstration of simple suturing. So you get the needle, hold it with the tip, and you always want to suture towards you. So this is a simple interrupted suture. So you try to enter the skin perpendicular, rotate it. You can come out through the center, re-enter, or you can do it in one bite. And as soon as it pierces the other side, grab it with the pickup perpendicular, hold it in position, grab it with the needle driver, and use the circular movement to take it out. So keep pulling till you get a small tail. This is the tail. Make sure this is very small, maybe half an inch or 3/4 of an inch, and then you tie the knot. The first knot is a double knot, so you hold the needle driver, go around twice, stabilize the needle driver, hold it with the tip, throw the knot, and try to move it on the other side. That kind of locks it, and if you can put the knot on the side instead of the top, that will help secure. Once that's done, then leave the tail on that side, make another knot, this time simple, grab the tail and throw the knot and move the tail to the other side. So this is a repeated movement. See how the tail is going from one side to the other side. That's called squaring of the knot. Depending on the type of suture you're using, you may require 3 knots or 4 knots. Sometimes with nylon, multiple knots. So this is simple interrupted suture. Alright, now this is simple continuous suturing. So you do the first knot exactly the way you did it before. Pierce it, grab it, rotate it, leave a small tail. So this you have done simple, and now you want to run it. It's basically faster, more hemostatic, like so you go through the same thing, same spot where you entered first, travel certain distance, maybe half a centimeters, and try to pierce it, take it out. Again, use the circular movement, and then go right opposite to it. Here, equidistance on both the side, equal tissue thickness, and pierce out at the other side. Pull it. And then keep repeating. Same thing. So advantage of this type of suturing is, number 1, it's faster, number 2, it's more hemostatic, and number 3, it's very useful when you're suturing the scalp or certain things. The only thing you have to worry that there is no infection, and it works great in certain area, although it is not the most cosmetic appealing scar you will get. Reaching at the end and you want to finish it off, then you will have to tie with the loop, and this is how you do it. So let's say this is the end of my incision, so that's the loop. So I just raise it a little bit and then tie 2 knots, grab this end up and throw the knot. So this is secured. So this loop becomes the tail, and then you tie in the same way. That's how you finish continuous sutures. Now let me demonstrate subcuticular suture, and particularly in laparoscopy where there are tiny holes, so I just put 1 or 2 interrupted subcuticular sutures to close. Subcuticular sutures does not involve piercing of the skin with the needle, so you are approximating the 2 edges together with a knot which is buried inside without piercing the skin. So this gives the most aesthetic, good looking scar, and that's the most preferred, especially when you are suturing the face or any incision which is clean. So I'll show you basic technique of doing it. So first thing, you clean up the edges, make sure it's clean, the wound is clean, sometimes you can inject the epinephrine with some local. That will make this area more visible or evident if the skin is very thin. So that's a little trick. So once you have prepared the edges, then you lift the skin up, get some fat tissue underlying, and get the skin from the dermis without piercing the skin. The dermis and the skin junction, you take it out, you grab it, again use the circular movement, leave the tail very small, move it towards you. You don't want this tail to lock. Once you are done on one side, then you re-grab, expose the skin on the other side, lift it up, again place the needle perpendicular at the junction of skin and the dermis, the 90-degree angle, rotate it, get little fat, stabilize the needle, release the needle holder, take it out from the other side. So important thing is equal depth, equal thickness, and opposite to each other. So that will create a good approximation. So this is the tail and that's the long side. So then you try to do a maneuver, kind of a shoe shine maneuver, to make sure the two edges are approximated. So you pull the tail towards you, and that gives the good approximation. Once you got the good approximation, then you can tie the knot. Make sure you don't pull on the initial knot. So it's a surgeon's knot, make it secure, lift it up, and then single knot, move it to other side, so that's a simple interrupted subcuticular stitch. Now if you have to do it continuous, once you have secured it, you can cut the knot into small and keep advancing the needle using the same steps. Lift it up, some fat, skin, bring it out, grab it, then go to the other side, expose the skin. You can pull the suture to get a better exposure, opposite to the previous one, get it in, same thickness, opposite to each other, grab the needle, and keep running. Once you are done, you can finish it off either making the loop technique, what I said, or you can exit out from the wound and let's say the wound is ending here, so you can exit out. This will probably be the only piercing through the skin, and then once it's out, then use that loop to tie the knot, something like that. Thank you.